Okay, just where my bags look okay. You gotta tell the truth.
Your bags are fine. You look beautiful.
I have bags under my eyes today because I have what's called a Disneyland hangover, where I went with my daughter and some of her best friends to celebrate a birthday at Disneyland. And it was a wonderful day, but it was also raining. I don't know what it is, but like everyone kept saying, you're going to have a Disneyland hangover for your recording tomorrow. And it's like I woke up and my whole body was like, what did I do?
Yeah. Yeah, I can imagine that. You definitely have a Disney hangover after being there.
Anyway, I apologize, but it's been a busy week. We are sorry that we dropped our episode a couple hours late on this Wednesday, but Brian is colon cancer clean again. Yay.
Yay.
He was getting his colonoscopy. We sound as good as we do because of two wonderful men in our life. One is my husband, Brian, who edits, and the other is our sound genius, Slow. So Brian was a bit busy in the butt. I
think we'll give him a pass this time. I think he deserves a pass.
He was a bit busy, so we dropped a little bit later. He did have a tiny polyp. So again, guys, get checked because those small polyps, get them out. Snip them out.
Snip them out.
Snip them out. And I'm happy to say while he got that tiny polyp snipped, they've already called with pathology and it was benign. So once again, that's what this month's all about, is talking about it. But because of our weird schedule, we are recording on a Friday for next week. Guys, we're letting you in. Guess what? We are not always live. So Molly, unfortunately, can't join us today, and we miss her dearly. But we will be joined by our favorite Dr. Steve, who is going to talk about his own colonoscopy last week.
Wow.
And yeah, I know. It answers some of the questions that we kind of brought up. And he's going to be talking about parasites. So, which I will tell you a story about in a second, Jennie, because I heard a story this morning that I immediately wanted to call you about.
Okay. Because you know parasites are my favorite.
I know parasites are your favorite, but I did not, because I was like, I have to hold it for the podcast for the reaction. So the story that I heard this morning is my stylist who blows my hair out. She told me the story about one of her friends who went to Vietnam, who's Vietnamese. And when he got back from a long trip, he was in the shower and felt something sort of peeking out of his bunghole.
Ooh.
And at first he was like, what's that? Kind of didn't feel, anything. And then realized it went back in.
Oh.
So he decided to
pull it out.
We'll say investigate.
Okay. Okay. Investigate.
To not gross anybody out. And it was a tapeworm, and he pulled it out. And then found out later when he went, assumed to the doctor, they like warm water. So they kind of like wiggle out a little bit.
Oh, I had never heard that before.
I had never heard that either. And I want to ask you if you had. So you have not heard that. So we will have to ask Dr. Steve about the warm water.
Yes.
First, we're going to talk a little bit more about colon screening and colon cancer. But I was like, oh my gosh, I just visually was like, can you imagine like standing in your shower? But it reminded me of the story you told.
Yes.
When we first started the podcast.
Yes. My mom was a nurse. And when she worked in labor and delivery early on in her career in Chicago, they were in the middle of a delivery and they saw something wiggling.
That wasn't a baby.
That was not a baby in the woman's vagina. And this is when they were starting the prep for sewing her up and stuff.
So this was after the baby was born?
This was after the baby was born vaginally, and they were getting ready to just do the closing and everything.
So she probably had an episiotomy?
Yep, she had an episiotomy, and they saw something wiggling, and it was a tapeworm. And they pulled it out, and it was over a foot long.
The moment she told me this story, I was sitting there thinking like, wait a minute. Am I crazy? Or did Jennie tell me a story about the other butt, as my kids like to say?
Yes.
and a tapeworm coming out.
Oh, gross. The drama's about to end, 'cause gross. Stop asking for a friend, taboos. Icky is what we do, just science. Yeah, it's not so weird. You're gross out, Johnny. Right here on Oh Gross.
Oh, gross. And we're back.
What has been wonderful to see is a lot of celebrities on TikTok and Instagram and just social media in general talking about colorectal Cancer Awareness.
Mm-hmm.
Obviously, some that have experienced it themselves, but also just I saw this morning Bethany Frankel showing her fashion statement for her colonoscopy. So this is what I'm wearing. This is how I prepped, down to her sunglasses, which I thought was really smart. Because, they always say you want to grab somebody in the first 5 seconds, but also to remind everyone, go get your butt checked. She literally said it's just as important as your mammogram. Go get your colonoscopy. So that made me really happy. So we will now bring on Dr. Steve, who can talk about his colonoscopy recently.
It's been a colonoscopy week around here, let me tell you.
And Jennie, I hope you scheduled yours or in the process of scheduling yours.
I actually did and called the lab, and they're supposed to be calling me with the availability for the next month. So
wonderful.
Ooh.
Woo! That's what this
Woo!
month's about. All right, let's get Dr. Steve on. Welcome, Dr. Steve.
Welcome. Karen. Hey, Jennie. Nice to be back.
Yeah, we're so excited to have you here right now. We have a lot to talk about today, but Jennie and I were just talking, and I was telling her I went to Disneyland yesterday with my daughter and some friends for a birthday party, and I could not get fecal veneer out of my head. And
sorry to have ruined your family outing.
But here was the thing I have to ask you. So I love ice water. So we went and we had dinner, and I got an ice water to go to be able to get back out there again. Realized I had to pee. So I went into the bathroom with my ice water and my lid and my straw, and as I heard all the flushing around me, I went to the sink and I literally looked at the mom who was in the bathroom with me. I'm like, what did I just do? Why did I bring this ice water in with me? And it was so hard to get the ice water. So I was like, what do I do? Okay, do I throw it out? So I lifted the lid and the straw when I got out of the bathroom and threw it out and then drank the water. Did fecal veneer get into my ice water or not?
That can depend on other factors too. But no, thankfully, if there's a top on it, usually the bacteria have to come in either and land. And thankfully, if you're not around immediate aerosols, like around a commode, it probably is a low risk of problem. It would be the factor of how well you wash your hands before doing all of that.
I washed my hands well. I sang happy birthday 15 times.
Then you should be fine there, I think. Yeah.
Well, but I was hearing flushing around me as my ice water cup was in my stall.
So you were imagining the fecal veneer just flying right into your straw.
It was the automatic flushing toilets that don't close, the commode doesn't close. And all I kept thinking was it was like a symphony of just fecal veneer popping off and on the whole time.
Thankfully, imagination itself doesn't cause too many illnesses, but you want to stay away and leave it to the imagination is the key there, I think.
But I guess all joking aside, probably don't bring your drinks into the bathroom.
In general, that's probably a fairly good idea. The main thing in around the bathroom is more hand washing than it is aerosol stuff, unless there are a bunch of people with COVID in the bathroom, which I guess could be a problem. My niece, Elizabeth, went to Disneyland as part of when she worked in a law firm in California years ago. And she was there at the time where a measles outbreak started, where some folks from out of the country had visited and it started a bit of an outbreak in measles. So
I remember
measles
that.
is the most contagious disease just about known to man. And so you can have a person go in with measles in a bathroom and leave, and an hour later you can still get measles
from the air.
So those kind of things are different. Those really airborne things you've got to worry about in those scenarios, but less the stuff related to just touching, thankfully.
And also, when we were talking about fecal veneer in a bathroom, we were talking about airplane bathrooms that are tiny, tiny, tiny spaces.
Exactly.
Where
you flush that thing and it's
everywhere, as opposed to a large bathroom. Yeah. But it was really funny because I just literally froze and I was like, I just fecal veneered my ice water that I've just been so excited to drink right now.
Worse things can happen, but I can't think of many. I agree.
I don't blame you for thinking that at all, because I would have thought the same thing.
But to go on to butts or keep the butt conversation going. As you know, Dr. Steve, my husband is a colon cancer survivor, and we are taking this whole month to continue to raise awareness for colorectal cancer screening and just awareness in general. And I'm proud to tell you that Brian got his colonoscopy on Wednesday, and he is still cancer clean, 15 years.
Terrific.
And you just had your colonoscopy, correct?
I did a week or so ago. How time flies, but yeah.
We were talking when you were gone, because we were talking about you coming on last week. So while you were under getting scoped, we were talking about you. If your ears
Nice to be remembered.
your ears were ringing. But it was funny because a couple of things came up that I said, I'm going to stay in my lane. I'm not a doctor, right? And we're going to ask Dr. Steve, while I know you're not a gastro, you obviously just went through a colonoscopy and you know a lot of the basic things. And so there seems to be a lot of fear, which I was unaware of because I think I've been having my butt scoped so long because of the history here in this household. But there's a lot of fear about the actual colonoscopy for people. But I thought maybe we'd get a little more into technically what happens during a colonoscopy so people could understand the basics.
Sure. And, the thing to be afraid of is colon cancer.
Right.
The colonoscopy is one of the best naps you will ever have.
Yeah, that's what I said.
Relaxing and so forth. It's the prep that's the problem. And there's a Dave Barry Miami Herald article on colonoscopy. If you've never read it, it is an absolute laugh out loud kind of deal. But the prep, I've had several of them because I didn't actually have colon cancer, but I had a polyp that forced a right hemicolectomy on me way back when, and doing fine, thankfully. And it actually wasn't cancer; it was a precancerous polyp. And I can tell you, I've had several prep, which is the thing that really people don't like. And though they're no fun, but I can tell you, it's just not that bad if you've been through it. I had a terrible meeting that I wanted to avoid last week, and I'd have gone through the prep just to avoid that meeting.
Right. It's 100% true. Will you explain for people who don't know, the point of the colonoscopy is early detection, right?
Exactly right. And so it is the gold standard. There are several ways to screen for colon cancer. There's the stool test where you can return a stool and they look for DNA of cancer. But if there's any ever question about that or abnormal test, or if you're a higher risk person at all, you should have the colonoscopy. And that's kind of the definitive thing. And they actually take a lighted scope and they go up through the rectum and then around the sigmoid colon and then up the descending colon, up the down staircase, so to speak. And then across the transverse colon, and then down the right side or ascending colon. And they stop about where the appendix comes in at the cecum, which is the beginning of the colon.
If you have an appendix, unlike me.
That is right. Yeah, well, I kind of lost mine too. So they just get a good look at those things. And the key is to get a good prep. And you want to get that stuff cleaned out so they can get a good look.
Right.
But this is one that is such a no-brainer. It really isn't that bad. And people just put their head in the sand. And I was late getting mine the first time, I'll tell you, not because I was even avoiding it, but, life is happening and you're busy.
It's not a priority for a lot of people.
Got to make the move to schedule it because, as I like to tell people, if you put your head in the sand, you're still going to have the same problem you had before. You're just going to have a sandy head to go with it. And
right.
You really need to do it. And now, they've moved the age down. It used to be 50.
Yeah, now it's 45.
And now it's 45. And I can tell you, a lot of us saw that coming for years because there were way too many people that we were encountering with tragic metastatic colon cancers who lost their lives in their 30s even, and little 40s. And finally, the tail of that bell-shaped curve got big enough to where enough people were to be saved by moving the recommendations down where that became the official recommendations to do it at 45. If you don't have one of those other problems like inflammatory bowel disease, some forms of it, some sort of hereditary polyp syndromes and hereditary Lynch syndrome, that would even cause you to have it sooner. But that's kind of a decision for you and your doctor to kind of make in close follow-up and discussion.
And I think, can you tell us your story real quick?
Yeah, so they found a polyp on the right side of my colon. It was under a little flap of tissue that you see there in the colon, and they just couldn't safely get it out without perforating the colon. And this was a number of years ago. They might have been able to do it today, but the problem was I wouldn't have lasted long enough for that to happen because it was kind of a precancerous tubulovillous adenoma, and those things can turn into cancer with some amount. So they found that, and a friend of mine who's doing the colonoscopy woke me up and said, I'm going to have to inconvenience you a little. I said, define inconvenience. And we got around to realizing I was going to have to right-sided colectomy, which was indeed an inconvenience. But I had another friend who's one of the best minimally invasive surgeons in the world, actually, and he performed that procedure, and it turns out it wasn't full-on cancer. The sad reality is that I lost a friend and colleague in infectious disease who had a scope and the same thing just a few months before I did, and his actually was cancerous, already had a lung metastasis, and he passed away a couple of years ago. There's tragedies that can be avoided if you get to things soon enough. And this is just such a no-brainer. But you're right, it carries this weird sort of, I don't want to do that. And so it's actually, the prep is a little inconvenient.
Right.
And the procedure itself is just simple. You wake up totally relaxed and napping, and you can't drive anywhere or do any work for the rest of the day. They're just all kind of bonuses.
It's like the best vacation. I mean, my husband had me driving around. It was raining here, and he was like, oh, I can't drive. We need to go here.
Yeah, no, so it's not that bad. And the benefits, I mean, we're talking about one of the most common causes of death, in the country, colon cancer. And it's just almost completely preventable. And we collectively don't exercise. We eat high-fat, low-fiber diets. We drink too much alcohol collectively. We sometimes smoke. And all these things that people don't do naturally are just increasing the risks.
We don't take care of our microbiome and talk about it enough of how important that is.
It's a fascinating its own topic. The microbiome has a lot more influence over things in our lives than we really even know about now. There are even those who are looking into taking too many antibiotics along the way, growing up, and in your middle ages, increase that too by messing up that. So we don't know the answers to a lot of those questions.
Yeah.
But it's exactly right. We want to do the things that we know work, and how much of those things go through the microbiome and the particular bacteria that live in our colon, we don't know yet, but we know those things work, whether or not it goes through that mechanism or not.
And when it comes to the colonoscopy, to go back to the basics, some people are afraid of anesthesia. And now they use propofol, but I was like, I'm going to stay in my lane, and I'm going to let Dr. Steve talk a little bit more.
This is just a relaxation drug. And I'm part of a heart transplant team here at our hospital, and we do colonoscopies on most of the people that are about to undergo a heart transplant, and they don't have the best situations going for them when they're undergoing these workups. So it's really a very, very low risk procedure. I mean, when you compare the risk of trying to go lifelong without one to avoid this kind of cancer, it's really not a terribly invasive or stressful procedure on the heart's lungs and so forth. And the medication is not full-on general anesthesia like you would have for an appendectomy or for colon surgery. It's a much milder medication like propofol that just makes you relax.
And David, our producer, had a question that he brought up to me that he was like, well, this is one of my fears. And he's had his colonoscopy, but that something could get left in you. At first I was like, David, why? But I got to tell you, I was talking to a group of people and they're like, no, I've thought about that. Because you hear these horror stories about surgery. So
right.
They're only putting one thing in you when it comes to a colonoscopy, right? Just the tube with the little light.
Right. They're not dropping breadcrumbs that they kind of know the way and on the way back out. It's an endoscopy scope. So it's a tube with a light on the end of it. And they do have a little extra thing that they can go and snare a polyp and pull it out.
Right, if they need to.
The next time I have ever heard of somebody leaving something in there accidentally be the first. Furthermore, they're looking at it as they're coming out. So
there's a camera.
You're looking at
it's
the thing.
One of those
so you have
things
to go,
that,
there it is.
Yeah.
Not that there is such a thing, but you can see what's going on. It's very high technical vision on those things now that they're really extraordinary. So yes, I've never heard of such a thing. And I did not have the first concern about that as I had mine last week.
Well, and I thought it was funny too when Brian got home and we were discussing how things just keep evolving.
Oh, yeah.
He was saying this time for him, from the last time he had one 4 years ago, that he even had less gas and bloating than the last time. Every time he gets one, it seems that they're needing to use less expansion because they do blow a little bit of air, right, to see better and things like
they
that.
Can suck the air back out as they come out, too.
Yeah, now it seems to be getting so much better that he even felt the discomfort.
I think that's been my experience, too. I've had more such preps and such than I would like, and I think you're right. The technology gets better and better, and it's pretty darn good now. It really is.
Yeah.
And they've improved the prep, right? I mean, isn't that what we were talking about yesterday? They've improved some of the things we can take to prep with.
I mean, for mine, it was a
over-the-counter
4-ounce bottle of something you drink, and then you do it again, 5 hours before the procedure.
Mm-hmm. Brian just had the way they did it this time was over-the-counter, not in prescription, basically getting...
Yeah, there are a lot of different ways to do it.
Drinking laxative.
There really are. The one I had happened to be a prescription. But
it depends on what the doctor wants to do.
Yeah, it really does. And there are a lot of different ways to do it. And certainly they're just much simpler. You used to have to they'd bring up this huge jug of things. You have to drink 10 gallons of it. And that was always kind of unpleasant. But it's very uncommon that you have to do that kind of thing now. Certainly not for the routine screening endoscopies anymore.
So once again, everybody, if you are 45 or older, you should be getting that colonoscopy.
Look, I mean, I'm a math guy. I'm a statistical guy, and play the odds, play the math, and it is a statistical no-brainer to do it, and it's just so simple now.
Exactly. It's so simple now, which pivots us to Jennie's favorite topic in the whole world, what happens to be parasites.
I love it.
So Dr. Steve has now become part of what I do to Jennie, where I'm like, what about this video? What does this mean? Is this a lie? Is this a myth? Dr. Steve, what do you think is going to happen? And I'm sending him all these videos, because I know when it's completely a total lie. But there are some of these things, especially with tapeworms and whatever, the worms are everywhere.
It is.
I sent a video to Dr. Steve that
Which
was
one of the gross videos are we talking about?
So the one that I sent you that was the pulling the worm out of the woman's mouth.
Oh yeah, you sent me that one too.
Yeah, Jennie loved that one. I was like, So we will post it on the internet for everybody to see. But it is the surgical procedure, correct, Dr. Steve, of removing it. You want to walk us through what the video is?
Sure. So this is, I guess they were pulling a long tapeworm in somebody's mouth. I mean, look, tapeworms, you don't want to get them. It's not the favorite way to try weight loss, though it does work for that.
So I know I don't have one.
Well, me neither. So but it also can cause anemia because those little guys suck the blood out of the lining of the tissue. In point of fact, most tapeworm infections are asymptomatic. When they do it, they don't usually go up in the stomach. They're usually down into the gut. So it's very uncommon for somebody to pull a tapeworm out of a mouth. And we don't usually even pull them out at all unless they become obstructive, unless they're so big that they're causing a problem and causing some obstruction somewhere in the gut. You usually just treat with one of several antiparasitics, depending on what the infection is. But they can be big. I mean, the one that's more common is the pork tapeworm. They can be, 10 feet long, and the beef tapeworm,
like that bear video that we posted online that we sent you, Dr. Steve, where the bear had like the 10-foot tapeworm hanging out his butt.
Yeah, it was lovely. But the beef tapeworm, Tinea saginata, can actually be much longer, 20, 30 feet long.
Oh, wow.
And they can be surprisingly asymptomatic in a lot of cases, though. As I said, it can cause some anemia from their eating too much of you. And then they can indeed cause some obstructive stuff. So occasionally you get that, but mostly they're kind of mild to moderate symptoms, maybe some cramping, that kind of thing.
Let's go back this out. Like I'm trying to figure out how this tapeworm gets to 10 feet. So I eat undercooked pork or any pork. Walk me through. I eat.
Yeah, so it's undercooked pork. So if you cook pork to the appointed temperature by the USDA and so forth, then that will kill those things. And what you have is little larval forms.
So it's a little tiny larva.
Yeah, encased in the actual muscle tissue of pork or beef in terms of the other one. And it's called cysticerci. And you eat those things and they will germinate and then they will grow into an adult worm. Okay. And then they'll make longer and longer segments, something called proglottids, individual segments, little rectangular segments, and they grow and grow and grow. And you can actually pass some of those proglottids.
What was that?
Proglottid is the name of one of those little bitty segments. They're segmented worms. They have little pieces and they're little squares to rectangles and they just make copies and they get longer and longer.
How long do they take to grow longer and longer?
A long time. They can be in you for months to years in that situation.
So theoretically, if you're pulling out a 10-foot tapeworm, that
it wasn't
sucker's
from last Saturday's dinner out.
Okay.
No.
It's a long time ago tapeworm. Yeah. Now, I've experienced worm in sushi. That's not the same, which I hope I didn't eat, but I don't know if I ate it, but it was 10 years ago. So now I'm like terrified.
You can get tapeworms, but a lot of times what people will get with sushi, you'll actually see these little worms and they're called anisakis worms. And they're
Jennie
particularly problematic too. They cause a disease called anisakiasis. Mm-hmm. And what happens is they'll go into your stomach or proximal part of your small intestine, the duodenum, which is the first part of the small intestine. And they'll actually burrow into the mucosa, the lining of the gut. And when they do that, they hurt. And you'll see reports of people actually cut open to find out what's wrong with their belly. They're hurting so badly when you really can go with an endoscope, the other end this time, the upper end, and you can find it and just pull it out. And that relieves the symptoms and solves the problem.
Have you ever had a patient that had worms?
Years ago, we had an anisakiasis when I was in training, but it's fairly uncommon. I mean, it matters where you get your sushi. If you're getting it from a properly sourced provider at a good restaurant, mostly they have gone through the stages and the steps to prevent these kind of things, which is mostly freezing. And so you're safe on that. You still might eat some dead worms.
I was going to say, do we eat the dead worms then?
You do, but call it protein, I guess. It's not going to be damaging to do that in most situations. So, but the idea is that you don't want a live worm that can then take off and do their thing in your gut.
So Jennie has 2 tapeworm stories.
When we were in the girls' R&B group, Molly and I, and we were touring around with a really famous pop group of boys.
I'm not going to say who it was, but it starts with Backstreet.
It starts with Backstreet.
One of their drivers, who we knew very well, he was supposed to be meeting us at the venue because we were doing a meet and greet or opening up, called us to tell us he was running about an hour and a half late to the venue and for us to meet at a certain time because he had to pull the bus over with a few of them in that bus and he peed out a tapeworm.
So he said he saw it. So to clarify,
he saw it.
Yeah, and then he pulled it out.
And he pulled it out.
What do we think about this, Dr. Steve?
First of all, I'm going to say I'm relieved because I was afraid you were going to be dealing with some sort of personal confessional story. So I'm relieved. I'm relieved, but...
So is he. He's relieved too, this guy.
I'm relieved.
That one I have to doubt. Tapeworms shouldn't really end up in the bladder. Now, some worms can. They can go to the bladder and they can cause bleeding called schistosomes or schistosomiasis. And so that can happen. They're not really that large typically. So,
Okay, I'm glad. That's why we do it. So all listeners, I want you to know, before I let that story be told, I will tell you 3 people witnessed the same exact call. Now, could that individual been told they were diagnosed with worms because something did happen around the penis and didn't understand the difference between a tapeworm and other worms? Is that possible, Dr. Steve?
sure. I mean, it depends how large the thing we're talking about. I mean, you don't really have large worms passing from the bladder. And though I don't do research in parasitology, I will run that down and see if I'm missing some obscure kind of situation.
My stylist, who told me a story, because we were talking about parasites today, told me that her friend, who's from Vietnam, spends a long period of time in Vietnam, on and off, went to visit family, came back, and he told her a story that he had a little gastro discomfort, nothing big, right? And was in the shower and he felt something moving about by his bum. Okay. Didn't know at first, then felt it again, reached out, felt like something went in, did a little research digging and pulled out a tapeworm, found out from his doctor that tapeworms like warm water. Urban legend of worms or possible?
I suppose that's possible, but you can certainly pass the tapeworms, no question. That's not the usual scenario that you get. In that kind of situation, a worm large enough there, you probably pass some proglottids, some little segments of the worm that you can sometimes see, and you can actually diagnose tapeworm infection like that. They're usually higher up than that, so I wouldn't say that's impossible, but I never had somebody come to me with that story. And I live inland, not on a coast, and there might be somebody that has seen more exotic parasitology tales, if you will, than I have. But I couldn't say that it couldn't happen, but I would think that's pretty uncommon.
What about warm water and parasites? And this goes back to the bidet. Do we need the bidet to see if we have tapeworms in our body?
Well, remember, it's 98.6 inside the environment that you're talking about. So people kind of forget about that. So the warm water is where it's living inside of you.
It's warm in there.
Yeah, exactly.
So maybe it thought the warm water was the same.
Yeah, it's funny. And I'll tell you that there are other odd parasites. They're like botfly larvae can land and the eggs can be deposited in your skin.
What?
And they have a little hole that it opens that they have to breathe through, which is different, of course, from the worms.
I've seen those in dogs before.
I've seen them in humans for sure. And usually it's somebody
layperson here. Tell me what this is.
Called a botfly, B-O-T-F-L-Y. And you'll get it in equatorial countries and warm climates. And you hang your clothes out and the thing will lay eggs on your clothes. Those eggs can kind of get inside the skin and the fly larva begins to develop. And it'll be the size of a roly-poly worm kind of thing sometimes. And they have little abdominal claspers that clasp in there. And it's very much alive and moving. And you can see a little hole. And every now and then there'll be a little white head that'll stick out of it and breathe and go back in.
Okay, wait a minute. Stop now. Okay, first of all, we have it all wrong, folks. Guys, we were all scared about spiders. We learned that doesn't happen. They don't burrow in your skin. But flies do?
They do. Yeah, the larvae from flies.
Okay, we're doing a whole episode on flies. That's it.
Yeah.
I pulled one out of a dog one time in undergrad, and I had never seen anything like that before. I mean, I found it fascinating and really fun, but...
Well, the way you fix it is you can take a scalpel and cut the thing out, but you can actually obscure the hole from the debris in it. Sometimes they'll crawl out. And some of my colleagues in Boston a few years ahead of me actually wrote a paper so that you could use raw bacon and put a little poultice, if I dare say that word.
Okay. A bacon poultice.
Wait a minute. So the flies are not vegetarian.
Yeah. And you pull that off and pull it out.
They're meat eaters.
So we had a kid from
bacon.
Central America that had this happen, and I ordered some bacon from the cafeteria so we could do this, and they sent me cooked bacon. So I went, ate the bacon, said, no, I want raw bacon. And so we did actually have to, we put that on there, and after a while pulled it off, and we were able to clasp.
Okay, so they're, okay,
that is
so
fascinating.
Explain to me why they're attracted to the raw bacon.
It turns out they're not attracted to raw bacon at all. It's just you're obstructing their air source.
But why bacon? It was
just what they tried in that paper.
So it could be anything that would smother their air. You didn't need bacon.
Yeah. So they can be of substantial size. They crawl out before they fly away, but it's they're impressive to see.
You know, Kara, there are other bugs though. And I'm sure Dr. Steve knows a lot about this, and I wonder if you've seen a human. There are bugs that transfer other parasites, like mosquitoes can transfer heartworm larvae.
Yeah, I knew that.
Not
especially
to mention,
in dogs, right?
Yeah, and those things can actually go and end up in the lung. Very rarely in people, they don't cause any problems other than being mistaken for lung cancers. And sometimes in those kind of situations, I mean, think about it. Malaria is a parasite. It's a blood parasite.
Right.
It's probably killed more people than almost any other disease in the history of the world. And mosquito bites you, injects that parasite, and then it goes to town and creates copies and infects your red blood cells and can cause, obviously, very difficult and fatal disease.
Back to the worms.
I knew we were coming back there. One of my favorite stories in training was I was called for an emergency consult up on the pediatric floor, and I ran up there and found a young boy about 8 years old sitting in the bed perfectly happily. He was from Kenya and only just recently had come to the United States. And he was sitting there in the bed, sitting up perfectly happily with about 4 inches of worm dangling out of his nose.
Oh, my goodness.
And so I looked at him and I said, have you ever had this before? And he said, no. I said, some of your friends had it before? And he started grinning and said, yes. So I asked for some gauze to pull this out. And we pulled about, 8 inches or so of worm out of his nasopharynx. That was an ascaris worm, which is a much larger worm. They go kind of quite.
That'd be uncomfortable, wouldn't it?
He was perfectly okay at the moment, but I can't imagine it would have been easy later in the day. Yeah.
Sounds like to me, out of all the urban legend of worm stories we've heard, that the butt story in the shower is probably the most likely if one were to be true, because it's the butt, right?
Yeah, no, one could pass a tapeworm, no question. In fact, what happens is when you kill these tapeworms with the anti-parasitic medications, and there are several, they basically just die and relax and fall off. And so you can pass the worms after that as well.
So worms can come out your nose. They can come out your bung.
Yeah, ascaris worms, they're much larger, and they're around a pencil.
How do you get those? Is that same thing eating something?
These parasite life cycles are very, very complicated. They will go in your gut. They will then go through the bloodstream when they burrow through your gut, go to the lung where you cough them up, re-swallow them, and that's when they grow into the mature form and excrete eggs and the like.
So you cough them up and then you re-swallow them.
Yeah.
How do I know if my cough is a parasite or not?
Well, we'll give you the benefit of the doubt on that one. It is thankfully uncommon. But here's the thing that's really weird. Parasites have certain animals that they're supposed to have these life cycles go in. And so those same things that cause the pork tapeworm, the 10-foot tapeworm, if you then take eggs and eat those eggs by fecal oral transmission, you ingest accidentally some of the fecal veneer, then what can happen is they can go through your bloodstream and land in your brain. The same thing that causes the tapeworm, but it's called neurocysticercosis. Those larvae form, rather than being in the muscle of the pork that you're eating, they end up like that in you, and they tend to go at places like the brain. So it can be an important cause of seizures and can really be sort of a dangerous thing. We see those not uncommonly in folks who come here from Central America. And if you do an MRI scan of their head, you'll see these little larval forms, cysticerci, in the brain. And you can even see the little head of the developing tapeworm, but they're much smaller.
And how do you treat it when it's in your brain?
I was going to say, what do you do for that?
Yeah. So some of them, the parasites have already burned out and died there because they're not supposed to be in us. They can't really flourish there like they can in other animals, like in that case, pork. So a lot of times you don't even have to do anything in the way of antiparasitics. It's kind of burned out, and you just give anti-seizure medications if they present with a seizure. You can give antiparasitic medications to kind of kill them off faster in some situations. It depends on the situation that you're in. But the big problem there is that they cause calcifications and scarring where they were in the brain, and it can lead most typically to some seizures along the way.
And that can be long lasting.
But the point is that these life cycles are very complicated, and so it's supposed to be in pigs. But if you ingest stuff in the wrong way that the pigs would have, then you can end up with a different form of disease. You don't get the tapeworm. That was sort of the typical human form of it, but you can get an aberrant form of what happens to the pigs. Yeah. And it ends up in you, in the brain or such, rather than in the muscles of pigs with those same little larval forms.
Well, we had Mama Jan on, who was a vocal coach to Jennie, but also any great singer that you know. She's a legend. And we were surprised because she revealed to us that she had gotten worms, and she was a nail biter for a long time. And she believes she got worms because of
From
biting her
biting
nails.
nails.
And her symptoms, how she found out, was excruciating abdominal pain. And then they told her, like, oh, you have worms. And they said, we can do this and it'll get out in, a couple weeks for the treatment. She's like, no, get them out now. I don't care how strong the medication is. Just get them out.
And they gave her the shebang, and
They
she
gave
said,
her the shebang,
I didn't
yeah.
care. It was awful, but it got rid of it in 2 days.
Remember, there are all kinds of parasites, more than just the ones we read about from sushi. There's the African eye worm that I've seen a couple of, and it goes to the system and literally crawls across the surface of the eye in the adult form. And it's just sort of weird sorts of things, to be sure.
Where do you get that from?
You have to be sort of in Western Africa, but it's more of, that's the name, the African eye worm. Loa loa is the name of it, Loa. That can be from bites of insects and such, too. They can deposit that in the blood, more like a malaria kind of situation. But think no further than the pinworm. I mean, in the United States, that's probably one of the most common things you see.
Very prevalent.
And your kids have an irresistible urge to scratch their backsides, and
Right.
they picked it up at school, and you have to practically boil the sheets to get rid of it. But they're interesting because they come out at night too. So if you just check for those eggs in the perianal area, you might not see anything, but you go in and kind of wake them up at night with this little sticky paddle that you can then submit.
Wait. Okay.
That's why they say look with the flashlight at night.
Yeah,
they come out in the dark, or they're nocturnal?
these very small worms come out at night.
They're nocturnal butt worms. Okay. Wait, I did not know this. Okay, this is where we got to circle back to, because pinworms are very, very prevalent here. I mean,
And our kids are going to probably get them because
we stop saying that, because we get everything that we talk about. So we
have little boys that we have to force to wash their hands.
This stinky.
Yeah. And so it's probably going to happen.
So wait, how long can a pinworm live in you? What happens if it's living in you for too long? Walk me through it all.
It can last for some time, and it's quite uncomfortable. It's usually not a dangerous sort of thing with pinworm, and it's easy to treat in order to kill those. But yeah, they can last for a pretty good while.
But they won't grow into big worms into your intestines.
No, they're not really large animals.
Okay.
or they're not.
So when I look with the flashlight or I look with the sticky thing, am I seeing like a bunch of little tiny wormies coming out like this? Like, hello?
Thankfully, it's not that dramatic, usually.
Okay.
But, the best way to do is to take something.
You just told me about a worm coming out someone's nose. What are you talking about dramatic?
Well, that was dramatic, admittedly. But they are more uncomfortable to kids. Not a dangerous thing, but when you find it, you can treat the kid with an antiparasitic, and then you have to just clean up the area very well. And you have to, if it comes in a school class, it can be kind of inconvenient. It's kind of like lice or scabies, things like that, in terms of the impact that it has on.
No, Kristen Bell talked about getting the worms from her kids.
The pinworms?
Her butt was itching. She was like, oh no.
Appropriate response, I think. That's true. Another one that you can get in the temperate climates, more the southern U.S. and then more equatorial climates. So it places something called strongyloides. And it's another worm that can inhabit the gut. And usually there's not a big problem with it. But if you're about to immunosuppress someone, so for example, when we're evaluating someone for a heart transplant or bone marrow transplant, we'll check an antibody for that to make sure they haven't been infected. Because if you get immunosuppressed, all of a sudden that strongyloides worm will undergo something called a hyperinfestation syndrome, where it will penetrate and make copies of itself, and the progeny will then reinfect you, and that can get into your bloodstream. You get bacteria in your blood that are carried on the back of these invading micro worms going into your bloodstream, and it's a highly
This is like a bad
fatal
sci-fi movie.
Yeah, it's a highly fatal illness, so you want to treat that sort of thing with, you remember, ivermectin.
And how do you originally get those kind of worms?
Say again?
How do you originally get that?
Through soil. Yeah, through contaminated soil.
That's all going to be through soil.
And the treatment of that is ivermectin.
Okay.
And though I don't think it works at all for COVID or a lot of other things, I probably use more ivermectin than most people in town, because we have to give people therapy for that infection if we find an antibody that says that they have had it before, because we've got to get rid of that before we immunosuppress them, because that can be life-threatening.
When you're running these tests in general, how often do you find people test positive and have?
Once every few months. I mean, I'm more in a southern climate, so people from down in Mississippi, Alabama, that kind of place will have more than somebody in the north, just because there's much more load in the soil of those worms than there are in northern climates.
Okay. Does LA have those? That's what I'm really getting at.
I wouldn't try to have much dirt in my mouth, though, just to find out. So it could happen.
Kara, I just want to make sure you're going to be okay after
I'm going to be okay. I'm fine.
Because I can just see those wheels are turning.
Knowledge is power. Knowledge is power. Which brings me to this. Okay, bring it back. We don't want to scare anybody, but this whole conversation started, to be clear, because we are seeing a lot of fear mongering about worms. I don't know what these trends are, but
tapeworms are a big thing. on social media.
Yeah, right now it's tapeworms and the sushi worms and the salmon worms, right?
The salmon worms.
Is the same worm in salmon the same as sushi, basically? Is that the same when they show those? Like the video I sent you, Dr. Steve?
Kind of raw fish. There's some delineation of species, like but the North kind of Atlantic and Pacific fish tend to have some sorts of things. And we've kind of only scratched the surface. There are other things that you can get. But I would say this about sushi. I mean, the whole idea is people all the time ask me, do you eat sushi? And I'm not a big fan of sushi, not that I'm even that afraid of it, but I would say this, for most people, they have those freezing protocols that we talked about that are encouraged by various regulatory bodies, and most reasonable places, certainly the higher end places that have well-sourced seafood, put it through that freezing cycle, it's going to be safe for most people.
Right.
If you are one of several groups, however, you need to be a little bit careful. If you're pregnant,
right.
If you're immunosuppressed,
right.
or if you have liver disease, for example, and that's not so much because of the parasites, but there are other bacteria that can be involved in some of these seafood things, a thing called Vibrio. And Vibrio can be a fulminant kind of infection. I had a young man who was at his father's funeral and had eaten some raw oysters a couple days before and came down and got 103 fever and had to be carried out of his father's funeral. He was so ill, and he died. And he had some underlying liver disease that made that happen. And in fact, one of my first weeks as an infectious disease fellow in Boston, one of my colleagues found a guy with a disseminated Vibrio infection, and it closed the entire beaches of Cape Cod down for a few days while they had to inspect water and take more samples.
Well, there was that couple recently that was all over the internet too, because like they both ate oysters, and the next day they found themselves in the hospital, and he woke from like a 4-day semi-coma.
A lot of that is Vibrio, which can be a very fulminant infection and can take people's lives. So you want to wash those things well, but again, that depends on where they come from. You can see Vibrio sometimes in the Gulf water.
And I have seen a worm in my sushi. I mean, it was the sushi place in Hollywood. On the corner. I'm kidding. I'm one time. It's still there. I think it's still there. I don't want to put a damper anyone's business. I'm not going to say where. But what is the advice? You see a worm in your sushi, just throw the rest of the sushi out.
I probably have to speak to the manager on that one.
Right.
But it can happen. It can happen. You can get a good restaurant and have a fly that flew into the oven and baked into your...
Listen, I'm more worried about the flies now than I am about the worms. I mean, come on.
It's not the kind of thing that should make people panic. Tapeworms are, in fact, uncommon. They're mostly asymptomatic. I mean, you don't see people at the bus stop pulling 10-foot worms out of their mouth. It just does. That's a very uncommon scenario, and it's not very common in the U.S. anyway for that to happen because there's just a little better sanitation and such. So it's all about common sanitation practices.
Common sanitation practice.
If you want to be sure, you cook to the temperatures, and there are charts out there. No need to memorize them. Different for fish and chicken and so forth. If you cook things to that temperature, you're in good shape. And
you're not going to get worms from cooked pork. You're not going to get worms from cooked fish. You're not going to get worms
the proper
from
temperature.
Cooked.
And the other thing is to be careful in your food preparation, because you may have something raw that then will contaminate what you've already cooked, and you want to be careful to set things apart that might be contaminated. Chicken is the biggest offender, and I've seen some really horrific cases.
And the wood cutting boards.
Yeah, exactly. I've seen some terrible invasive salmonella infections just because somebody didn't wash their hands when they cut up the chicken. I mean, that's what you should be afraid of so much, not so much.
Not the worms on the TikTok.
For every sushi related awfulness, there are many, many, many people hospitalized for salmonella infection just because they just didn't keep things clean that they were working with. That's really the much bigger risk.
Mm-hmm. And as far as the videos, because this is what we got to bring it back to, the videos I sent you, do we think they are real?
Not saying it couldn't happen, but pulling 10-foot tapeworms out of somebody's mouth. Now, maybe they went down with a scope, so that certainly could happen. You can go down the scope, find an obstructing worm in the proximal part of the small intestine, duodenum, and you could pull it out. So it's certainly possible that could be the case. But put it this way, my next one will be my first one.
But we need to remember when we're looking at things on social media about worms, about anything, any video, to take it with a grain of salt, and that fear-mongering happens. And then what he is just have the real knowledge. And the real knowledge goes back to always what? Wash your hands. Right? Wash your hands.
Wash your hands. Yeah.
Wash your hands.
It's funny. Your grandmother was right. And I can just say, I think confidently that if you're going through your day worrying about having problems with parasitic infections, you are wandering by a whole lot of much higher risks than that and not thinking about them. I can tell you that.
Mm-hmm.
And I know I texted you about this. The girls and I talked about this article I found that there was all these studies done that like men are not washing their hands as much as women. And you were like, oh yeah, I know a lot about that. Like, right? And that's true. That is true though. You said that is an actual, that has been brought up before.
It's something that you kind of observe. They've gone to medical conferences and staked out people in bathrooms, but they found that the hand washing rate was really, really concerning. So this is among people that know better. And so, yeah, I think people in general don't believe in the germ theory. And I've always laughed because that's only partially true. It depends on what it is. I've always said that all hospitals in America should take all their isolation precautions and change them to lice precautions. And only the infectious disease doctor knows who has lice and who has these other bad things. And then everybody would comply completely and everybody would wear all their stuff. And
I guess nobody wants lice.
Right.
And frankly, they're an inconvenience, but they're nothing of any danger compared to the things that we need to isolate and wash our hands from. But yet it sort of captures the imagination, and lice and scabies, it just makes people skin crawl, and that they pay attention to that.
They pay attention to it more, which is, I think, hilarious. So we will have the videos up on our website. And Dr. Steve, if you don't mind, I will tap you to sort of give us a little more insight on each one so we can kind of explain to people what it's supposed to be or it could not be. And I think the most important thing here to remember is wash your hands, right? When it comes to raw food in general, if you're going to decide that you want to eat something raw, just know your risks and know where you're getting it from. And don't worry about some of these things. If you are cooking your food all the way and you are washing your hands, there's a lot more things you can worry about than the 10-foot tapeworm being pulled out your butt. Was that a good summary?
I could have said it better myself. Wash your hands and cook your food to the prescribed temperature, and you're going to avoid most of the troubles out there.
And when it comes to colon cancer, what you need to worry about, parasites are probably lower on your list than the other things.
Yeah, and meet with your doctor and say, what am I at risk for? What do I need to do to screen? There are important other important cancers and things to screen for. I mean, there's so many things out there that a good primary care provider can clue you into. And, there's no reason not to live a better, healthier, and longer life if you can do that with some simple steps.
Worry about the important stuff. You can be entertained by the other stuff. Lord knows we all are. But once again, get your colonoscopy. You know what, guys? If you're one of these people commenting on the internet about tapeworms, get your colonoscopy. They would see it, right? They would see the tapeworm. Well, thank you so much, Dr. Steve. Once again, this was the best.
Always great to meet you guys.
I love all the information. I want to come shadow you at work one day.
Better be careful what you ask for. Yes.
Always fun to talk to Dr. Steve. And always informative. He is hilarious, the things he has seen.
And the fecal veneer is like...
The fecal veneer will never...
ruling my life.
Like I told him about Disney. Like that's all I could think about was fecal veneer. Like the whole time.
I would too. I mean, that's all I talk about at home. My whole family now talks about the fecal veneer.
But, because I love saying but today. Speaking of bizarre butt stories, can't wait to have Molly back next week because I heard she has a doozy about a Q-tip box. That she's gonna
you have no idea. And the thing is that she thought she was going to get away with not telling that story.
Now I can't wait to hear it. I literally can't wait to hear it. They've been keeping a secret from me, guys, so we're excited. But also, who's not here today? So Dave, our producer on the show, is not here today because Dave can't handle moving and working. Oh, Dave, I know you love I said that. So he is moving. So in order for our call to actions, Brian decided to just throw it in the AI and see what it came up with. So that's what we're going to do. We're just going to read what the AI said for our call to actions today, guys. We're just owning it. Here we go. All right. So it starts with this. What do you call a colonoscopy prep? A real gut-wrenching experience.
It's so dad jokey.
It's so dad jokey. Brian loves it. So if you're not following us already and you want to know more about that, follow us right now or go to our socials at It's Oh Gross.
Okay, and I've got one now.
Okay.
Ready?
Yes.
All right, here's my AI dad joke. Why don't colons ever play hide and seek? Because they know the doctor's scope will find them every time.
It's so bad. It's so bad.
So if you want to give us your colon dad jokes, Please hit us up on our socials at It's So Gross or on our website, ogross.com.
Yes, if you want more information on either bad dad jokes or more information on what you should be doing this month to, to prevent colon cancer, ogross.com.
Oh, gross. That drama's about to end, 'cause gross. Stop asking for a friend, taboos. Icky is what we do. Psoriasis, podiatrist, and pinworms too. It's so gross. No need for strife, because gross. Life is part of life, it's just science. Yeah, it's not so weird. We got the facts, nothing to fear. Oh, gross. It's just science, no, it's not weird. It's just science, nothing to fear. It's just science, so wipe those tears. It's boogers and a rash and that sticky scratch.